Hello, my name is Stuart Kim, and I'm the CEO of a DNA company called AxGen. This video is about osteoporosis, which is a major disease that's bad because you can break your bone from a simple fall, and that can have catastrophic consequences. And the problem is that most people with osteoporosis don't know that they have it. Now there's a new DNA test that will identify people that are at risk for osteoporosis so they can get a bone scan and thereby get access to healthcare and therapy to improve bone health before a fragility fracture. What is osteoporosis? Osteoporosis happens when your bone density gets very low so that your bones are weak and brittle. Then a simple fall can result in a fracture. Oftentimes this fracture is a hip fracture, which requires surgery and a long time in the hospital. And at the end of this, your muscle strength might have declined enough that you're not able to live independently. And so you relocate, the patient relocates to a nursing home 40% of the time. And in 20% of the time, the patient dies within a year of having an osteoporotic fracture. Now, 50% of women will get an osteoporotic fracture in their lifetime. And the major tragedy in all of this is that the vast majority of cases, 80% of people with osteoporosis don't know that they have it. So they're living their lives without access to healthcare for bone health or taking sensible precautions against suffering a fragility fracture. Now, osteoporosis is diagnosed with a bone scan called DEXA, which stands for dual energy X-ray absorptiometry. DEXA is the current strategy for using DEXA is to test for DEXA after there's after a patient breaks their bone for just a simple fall and you don't know why the bone would break so easily, so they do a DEXA test. Or they do a DEXA test for women age 65 or men age 70. Now, there are two problems with this strategy. First, doing a DEXA test after the fragility fracture is too late because the bone's already broken. All you know is that the reason for it to be broken was osteoporosis. Testing at age 65 for women and 70 for men is too late because at that age, there are less ways to improve your bone health. And your bones just can't respond as they would have when you're younger. Because when you're younger, you can improve your bone health with exercise and diet. So weightlifting exercise is a terrific way to improve bone health when you're younger. Weight-bearing exercise such as this will activate your osteoblasts in your bone, and they will build your bone. That's their job. Diet, so vitamin D and calcium, also strengthen your bones, but they do it less well when you're older. So the key would be to get and make your bones strong when you're middle-aged or younger. Now there's a new DNA test called the polygenic risk score that can be used to find people that should get a bone scan and should be thinking about bone health before an osteoporotic fracture. So polygenic risk score is a DNA test that has many, many, many different DNA variants. In this case, there are 22,000 DNA variants. Each DNA variant contributes a very small amount of information, but together they have a very sizable effect on your risk for osteoporosis. So in this figure, the x-axis is your DNA score, is a DNA score for many, many people. The left-hand y-axis is your risk for osteoporosis, shown in red. And you can see that people on the left edge of the histogram have a much higher risk for osteoporosis than people in the middle, 17-fold higher than people in the middle. People on the right hand of the histogram have a very low chance of getting osteoporosis. And for these people, they may not even need to get a DEXA scan when they're age 65 or 70. So this DNA test can be used in at least two ways to prevent fragility fracture and help people with bone health. First, for the general population, this DNA test will identify people that should get a DEXA scan and know whether they have low bone mineral density. And what's nice about this is that once you have a DEXA scan, you're right in the standard of care. And healthcare knows exactly what to do with a DEXA scan. And they will help the patient with the bone health. And that's well established. For people that know they have an issue with bone health, it's also, the DNA test is also informative because people with a low score should know that they're at risk for losing relatively more bone as they get older. Their trajectory will go down. And for people with a high score, they may expect that their trajectory is not so bad and that they may not have such loss with bone as they age. So thank you very much for your time. Take care, stay healthy, and goodbye.